Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome, everyone, to another episode of Nurse Converse. I'm your host, Wali Khan, and today I have a topic that is rarely ever talked about, but it is something that affects every single healthcare provider, and that is insecurities in healthcare. You know, I've been a nurse for almost 15 years now and practicing as a CRNA for the last several years. And even now, when I feel that I've reached the pinnacle of my career, there's always people that I come across that tell me that they feel so insecure about the work that they do. They feel so insecure being a nurse. They feel so insecure being a student. They feel like they're behind. They feel that they're not good enough. And the word that comes to mind is imposter syndrome. And whether you're a new nurse, a seasoned provider, or somewhere in between, you felt it. That voice in your head saying, do I belong here? Am I good enough? Are others better than me? Am I behind? Why do they all seem more confident than me? When they give report, when they're receiving a report, when they're doing a procedure, why does everyone else feel like they have it together and I don't? And you know, a lot of the newer nurses, a lot of the newer practitioners, whether you're a nurse practitioner or a CRNA, and I'm speaking from personal experience, when you see someone else that's seasoned or that's been doing it for a while, when they do something effortlessly, immediately you compare yourself and you say, why am I not like that? Why don't I speak to patients like that? Why am I not effortlessly able to perform these skills like that person is? Well, there's a reason for that, and we'll get to it a little bit later. But I want you to know that I've been there. And I'll tell every story that way because the conversations that you and I have, they're coming from right here. Lived experience, not hypotheticals, not some arbitrary thing that I read about, but things that I have experienced. And I want to advise you, as a mentor, as a big brother, as, just some guy on the internet, right? Like whatever you want to see me as. I want to advise you because I've felt these very emotions. I've gone through these very feelings, and that's where this comes from. And I want to share my story because if you're struggling with insecurity right now, this episode is for you. I can say with absolute certainty that nursing school didn't teach me very many skills. Did you hear what I said? I can say with certainty that nursing school didn't teach me very many skills. Now, many of you probably agree with that. In fact, it didn't really teach me the concept of bedside manners at all, because we would always go to our clinical sites in groups of like 7 or 8. There would be one nursing faculty, and they would kind of just throw us on the unit and pair us with, a nurse. And that nurse probably was good or great or terrible. It was like whatever you got for that day. It was somebody that was either on their phone and telling you to do everything or wouldn't tell you to do anything or wouldn't let you do anything, whatever the case may be. It was like the luck of the draw. And that came much later. Like bedside manners, how to talk to people, it came many years later of standing in front of sick human beings and their families. And many times just standing there, observing, listening, asking questions, learning how to be present. And in return, treating them with the same dignity that I would want for myself or my loved one. That's what taught me bedside manners, and it takes time. Additionally, I never started a successful IV when I was in nursing school. I never placed an NG or an OG tube in nursing school. And when I say nursing school, I'm talking about my clinical sites. I never put a Foley on a patient, be it an awake, alert-oriented patient or even an intubated patient. None of these things happened while I was a student. But here's what I learned. These are arbitrary skills that can be taught to anyone. They can be practiced, they can be learned anytime by anyone. What can't be rushed, though, is the time it takes to grow into a professional. The time it takes to become a practitioner of health, someone who doesn't just perform tasks, but holds space for patients, advocates for families, and leads with humility. One of my teachers in anesthesia school would say, you can teach a monkey how to intubate, right? You can, and I laugh at it now, but man, monkeys are smart, right? You can teach. I go online and you see a monkey smoking a cigarette, or a monkey be cutting vegetables with a knife in his toes, right? They're smart. These primates are smart. You can teach animals to do these skills, right? Birds can sing. You can teach them how to repeat lines of songs. But do they understand what they're saying? Do they understand the human element behind it? That's where you come in. You understand the root cause of insecurities in healthcare. Why do we feel insecure in this field? We're in a field to take care of human beings that are sick. That's it. Just that's what we're in the field of. But there are common roots that you need to understand. Number one, if you're taking notes on this, I strongly feel that you should write this down, because one or another person, someone is going to fall into this. And if you have a social media platform, you probably did at one point or another. Number one, comparison culture. We look at other nurses who seem faster, smarter, more put together, and we immediately begin to doubt ourselves. And that's what I started this conversation off with, is they can do all of this. Why can't I? Why am I not as good? Why am I not as smart? Why am I not as quick? Why don't I get it as quickly as they do? Number two, imposter syndrome. You may feel like a fraud even though you've earned every single thing in your life. You've earned every right to be where you are, but you still feel like an imposter. It's true. Been there. I was in CRNA school. I got in 3 years in, got hundreds of, skills under my belt, got thousands of hours, still felt like I didn't belong there. Clearly, my record spoke for itself. I did belong there. I've been working my butt off my entire professional career to be there. But this little voice in my head says, you don't belong there. And I know, and you know, that that's not true. Number three, if you're an ICU nurse, this is going to hit you like a brick. This is going to hit you like a brick in the face. Perfectionism. Healthcare, for good reasons, attracts high achievers. And with that comes the pressure to never mess up. Again, false reality appearing real. False reality appearing real. It's not true. Everybody messes up. Every surgeon has messed up. Every doctor has messed up. Every radiologist may have missed a certain read, right? Everybody has messed up at one point or another. This next point, number four, I spoke about this earlier. Poor clinical experiences. You could be at a teaching hospital where you got to do everything. You could be at a rural hospital where you were the sole person doing everything, and you're like, yo, I'm not even qualified to be doing this. Why am I doing it? Or you could be in a place where you did nothing but just watch, because they were like, no, we don't want you to do anything. Just watch, just shadow. Everybody's clinical experience is so diverse and so different. And you need to understand that. Maybe your preceptor made you feel small. Shoot, I had that happen so many times in nursing school, even in CRNA school. Just vindictive, vicious, vile, bad human beings that are unfit to be in the nursing profession or in healthcare. And even worse, a preceptor teaching somebody else how to take care of people. Maybe that was what you got. Maybe you weren't given room to grow. That's a very likely possibility. And then there's always this next factor, which is life outside of work. If you're dealing with stress, trauma, personal challenges, it can amplify your self-doubt. Many of these cranky, nasty nurses that we meet at work, charge nurses, whoever it may be, nursing officer, whatever, you've been there, you know what I'm talking about. What do they always tell you? Man, they must have a terrible life outside of here, and they are projecting what they live at home here in the unit. All those Karens and Kathys and Joannes, right? I'm just making these names up. If that's your name, don't take it personally, right? For all the Karens out there that are actually good, don't take it personally. But all them Karens that be showing up at the unit, just making life hell for new nurses, for people that are in the ICU trying to go to CRNA school, trying to go to NP school, trying to go to midwifery school. And they make people's life hell because they wish they could be that, but they're not because they're stuck in a rut. And that is a projection of themselves onto you. So what does that say? You're not the problem. They are. And unless you're able to separate these two realities, and that is true, they can be two realities. Unless you can separate these two, you will always think you're the problem. You're not good enough because somebody else projected their insecurities and their hatefulness and their shortcomings onto you and made you believe that that was your reality when it's not. Here's the truth. Insecurity is part of the journey. It doesn't disqualify you, though. In fact, it can be the very thing that leads you to being humble and giving you grounded strengths. There was a concept that the dean or the program chair of my CRNA school taught me. I'd never heard of that concept before. It's called humble confidence. Humble confidence. For me, it was like, wait, how am I supposed to be confident and be humble? Because anytime you exude confidence, you show people that you're confident, they think you're arrogant. So how do you have humility and have confidence at the same time?
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
Let me introduce you to this concept that changed everything for me. Humble confidence says, I'm still learning, but I'm still valuable. I don't have all the answers, but I show up with care and curiosity. Humble confidence says, I am not perfect, but I am present, and that matters. It's not loud, it's not flashy, it's steady, and it's real. That's the difference. It shows up every day with the inquisitive nature of a child saying, what is that? I want to understand it. I want to master it. And I will continue to show up until I have mastered it. And once I've mastered it, I will exhibit the mastery of that very thing. How do you build it, though? Now that you know what it is, how do you build humble confidence? You stay grounded in your why. Think about that. Many of us forget what is our why. If you're a parent, your why is your children. If you're a husband, your why could be your spouse. If you're a sibling or a child of someone, your why could be your family, your parents. If you're an immigrant, your why could be the incredible bounty and blessings of being in a place where you can obtain an education and provide for your family. Your why could be that you've chosen a career path where you get to serve humanity while feeding yourself and your family and so forth. I mean, I can't tell you what your why is. You need to spend time finding out what it is or perhaps cultivating it. It's not something you magically just go, well, oh, there's my why. I found it. No, the why can change over the years, but it's something that has to be cultivated for you to understand. Your purpose is your compass, plain and simple. Take a few moments daily, weekly, monthly, every 6 months, and reflect regularly. Ask yourself, what did I learn today? What did I do well? What can I improve on? And that was something that when I was in clinicals, especially in CRNA school, we went to different clinical sites every 3 months. Perhaps it was pediatric anesthesia or it was cardiac anesthesia, obstetrics, neuraxial, regional anesthesia. I would ask myself at the end of the day, what did I do good today? What did I do better today than I did yesterday? What is there for me to improve upon? What did I do well that I can only improve on as I become a professional, right? Practice without shame. And that's such a huge thing for students to understand, but also for professionals. Practice without shame. You don't have to have shame. Like, you don't need to be embarrassed that you don't understand something or you don't get it the first time around. Replace shame with curiosity and humility. I don't understand it now, but every repetition is a progress. Every question is strength. Every question makes me stronger. It makes me smarter and more brilliant because I know now what I didn't know, and I only know that because I questioned. Surround yourself. Man, your crew can make or break you. And you know what? Some of us are lone riders. We don't have a crew, right? We're like the Dark Knight, right? We just ride solo, and that's okay too. But if you're somebody that needs a little bit extra confidence, a little extra, just a little extra push, a little boost, right? A little scoot, surround yourself with people that encourage you. The people you keep around you shape how you see yourself. And that's why keeping good company, good, righteous company that will keep you grounded. And that, you know what? That will call you out on your stupidity and your foolishness and you being a slacker and, you cutting corners and you not doing the right thing. You need those people too. But those people that are calling you out, they're calling you out because they mean well, not because they're trying to chastise you and break you down and belittle you. There's a difference. And the crew that you keep, the people that you keep in your inner circle, will ultimately define who you are because their words and action will resonate in that psyche, in that space. And that will also help you build your confidence. So let's get practical now. What can you do when insecurities creep in? Reframe your thoughts. Instead of, I'm not good at this, say, I'm still building this skill. Study smarter, not harder. That, I mean, it's probably the most played out thing that you've heard, but you got to study smarter. Review cases that you struggled with. Review case scenarios, disease processes, things that you saw at clinicals that you didn't understand. Talk to your preceptors and your clinical faculty. Ask for feedback. Every single day, when my clinical day ended in the operating room, I would ask my preceptors to tell me what I did well or what I did poorly. In addition to our school making us fill out evaluations, I wanted them to tell me. I wanted direct contact. And sometimes they were able to, and sometimes they weren't. Watch how seasoned professionals handle patients. Observe, not just to copy, but to learn what it truly feels like to do it as a professional. For some people, this next thing is very helpful. Journal, write down in your notepad, maybe through a physical book or in your note app, just 5 minutes. What challenged me today? What did I learn? And what did I show up with heart? Where did I show up with heart? What was I really passionate about today? And then you hear this all the time, right? No such thing as a stupid question. It's true. Ask question always, because the most confident people aren't the ones who pretend, they're the ones who ask, because they have that confidence to say, I don't understand it, but I want to learn and I want to grasp this. I want to understand it better. So I'm going to ask. I'm not embarrassed of what this person in the room is going to think or that person in the room is going to think, because guess what? They probably get it, but I don't. So I'm going to ask questions. And, take a few moments before every interaction. Center yourself. You don't always have to rush to give an answer. You don't always have to rush to go do a skill. Remember, you're here to serve, not perform. What you're doing in clinicals or in class or in school, it doesn't need to be performative. At the end of the day, I keep stressing this over and over again. At the end of the day, we are in the business of taking care of human beings. These are real people, real lives, real ailments, real sickness, real emotion, real families associated behind the disease, the illness, the nursing diagnosis that you're seeing. Treat them as such. Let me remind you, you are not behind. You are not broken. You are not an imposter. You're just in the process of becoming. Becoming what? That's for you to decide. Don't let insecurities cause you to shrink. Let it challenge you to sharpen you. Let it humble you, not haunt you. Let it inspire you to listen deeper, to show up better, and to keep refining your craft. Keep refining your craft. I'll say it again. Keep refining your craft. Kobe Bryant would take one single jump shot 10,000 times in the summer. And then you and I would see him, Staples Center, buzzer beater, game winner. But that game winner was practiced 10,000 times in the darkness of the night or the darkness of the early morning before he showed up. So you ask yourself, what am I doing in my alone time before it's time for me to show up? How am I preparing? Because the greatest nurses and providers aren't the ones who had it all figured out from day one, because nobody did. And if they say they did, they're lying. They're the ones who kept growing, they kept showing up, and even when it felt uncomfortable, they showed up. And one day, without realizing it, you'll be the one someone else is looking up to and says, wow, I want to be like that. And when that day comes, you'll know, and it will be all worth it. If this episode spoke to your heart, share it with a colleague, share it with a student, a friend, a classmate, someone who might be feeling like they're not enough. Because my friends, you are enough, you are growing, you are becoming. Until next time, stay grounded, stay teachable, and lead with humble confidence. So grateful that you guys are here today. We'll see you on the next episode of Nurse Converse.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.